Winter often brings more coughs, colds, and flu-like illnesses. Why do these conditions spike during this season?
So there's a number of reasons why we might see a rise in illnesses during the winter. That can be cold weather, which can make health problems worse. It also means that diseases spread more easily because we spend more time indoors. Some viruses actually can survive more easily in cold conditions, and the cold can make it more difficult for your immune system to fight off any illnesses. We also see some kind of direct impact of illnesses, so things like hypothermia and others, which are obviously extreme examples, but also there's a lot of indirect impacts that you can see and illnesses through the winter, like it can affect people's mental health and others.
What are some simple hygiene practices people can adopt to reduce the spread of winter illnesses like norovirus and the flu?
So there's a few things that you can do really to help prevent illness spreading. But the main thing that we talked an awful lot about in COVID as well, was hand hygiene. So it's one of the most important ways you can have to stop spreading infections, especially those things like diarrhea, vomiting, respiratory infections. So practicing good hand hygiene, frequent hand washing, coughing into your elbow if you're coughing, will help prevent norovirus, viral illnesses and others like that. You need to use good liquid soap if you can, warm water, paper towels, etc. Alcohol gel can be used if your hands aren't visibly dirty, but the main thing is that cleaning your hands regularly when you've been to the toilet, before eating, handling food, if you've been touching animals, anything like that. The other thing to bear in mind alongside hand washing is that catch it, bin it, kill it. If you've got a cough, if you've got a cold, sneezes, make sure that you can cover that, catch it in a tissue, catch it in your arm and bin that to stop spread and keep surfaces clean.
Vaccines are a big part of staying healthy in winter. Why are flu, COVID and RSV vaccines so important? And what advice would you give to people about preparing for the holiday season in terms of prescriptions and accessing healthcare services?
This time of year particularly, we strongly encourage our residents to strengthen their winter defences by getting vaccinated against the flu, COVID, RSV, all of those vaccines that are offered to you, either because you're vulnerable or because you might pass on something to somebody who's vulnerable. It's really important to take those up, and that offers the best protection against serious illnesses from some of these common winter viruses. Even if you're not in a vulnerable group, you can prevent the spread to somebody else. So thinking children, young people, for example, if you want to have the flu vaccine, that then helps prevent that spreading to others. But if you're in one of the most at-risk groups, so you might be over 65, you're pregnant, got a long-term condition, then we really encourage everybody to take their vaccines up, and that will prevent you getting serious illnesses and also maybe passing on to other people. If you get vaccinated, for example, flu or for COVID, you're likely to have milder symptoms and recover better, cutting your risk of being hospitalised. We know, for example, that with COVID, the vaccination reduces your risk of hospitalisation by around 50% compared to those who hadn't had their last dose in the last 6 months. So we know that that will impact and lead to better outcomes.
How can diet, nutrition and exercise boost immunity during winter?
Maintaining a healthy, balanced diet provides you with the energy and nutrition you need to function, and it's an important part of maintaining good health. If you eat a wide variety of foods in the right proportions and consume the right amount of food and drink, you can maintain a healthy body weight, and that provides you protective health benefits against certain health conditions such as coronary heart disease, stroke, type 2 diabetes and certain cancers. Obviously, it's good to keep an exercise. It's good for your mental health as well as your physical health, and making sure you get plenty of rest as well, particularly during the long winter months.
Long nights and short days can really affect people's mood. What are some simple ways to stay active and lift your mood during winter?
Get out and about. 15 minutes outside if you can. It's really good for your endorphins and lifting your mood. Meeting people, fresh air gives a good routine and breaks up the day. Engaging with people and others for social connection and well-being. Making good food. We know Christmas and New Year can be a really difficult time for some people. Those who have been struggling, particularly with day-to-day life this time of year, can be really overwhelming. So we want to raise awareness at this time of year and remind those people who are suffering in silence and struggling to cope that help is available and they're not alone. Throughout the festive period, organisations will be highlighting those services that remain open and available. Samaritans will be available throughout the festive period. Anyone needing help can call Samaritans for free on 116 123. For those who find comfort in text communications, we've got Shout, and that offers a text services for anyone who's struggling to cope. Simply text Shout to 85258. For Shropshire Council, we've got Pick Up the Phone, You're Not Alone. You can go straight to our web pages, and there's information there for everyone who needs any help.
So what are your top tips for keeping homes warm and comfortable during winter?
So ideally, heat your rooms to at least 18 degrees centigrade. Wear several layers of clothing, and that'll keep you warmer than one thick layer. For extra warmth, use a blanket or a hot water bottle if needed. Also try and reduce any drafts. Fit draft excluders around the door quite cheaply if you can. If you're struggling to heat your home, please consider visiting one of our local warm spaces like libraries or leisure centres, as well as other community venues we've got across the county. If you're worried about money or struggling to pay for essentials, contact your local councils for assistance. Shropshire Council's got an affordable warmth and energy efficiency team with our partners at Martyrs Energy Association, and there's a wide range of support and grants for those who might be in fuel poverty. Keep Shropshire Warm is the council's free and impartial energy advice. There is advice on both of the council's websites for those who are struggling with cost of living or keeping their homes warm this winter.
If someone starts feeling unwell with typical winter illnesses, what's your advice for managing symptoms at home?
My advice is rest, sleep and stay hydrated, including having warm drinks. Treat pain relief at home if you can, and avoid contact from others and keep good hygiene. So on that subject around medicines and keeping things stocked up, it's really important to make sure you've stocked up your medicine cabinet. Make sure you've got essentials in there, paracetamol, plasters, simple dressings, Calpol if you've got children, for example, age appropriate. Check the expiry dates, so replace any out-of-date medicines. Make sure that you can manage any minor health conditions at home. And if you have repeat prescriptions, make sure you order those in advance.
To wrap up, can you recap on the key steps listeners can take to stay healthy this winter?
So I think that my main message is around the importance of self-care, good hygiene and particularly hand hygiene, and eating and sleeping well and exercising.